Leptospirosis, caused by the Leptospira bacteria, is one of the oldest known zoonotic diseases, affecting both animals and humans. Though its exact origins are difficult to pinpoint, historical records suggest its presence for centuries. Misdiagnosis was common in the past due to its symptoms resembling other febrile illnesses like malaria or typhoid fever. The disease often went undetected in regions where medical knowledge was limited, particularly during times of poor sanitation and public health infrastructure. The disease primarily spread in environments where humans and animals coexisted closely. Agricultural societies, especially those engaged in rice farming or working in flooded fields, were highly susceptible. Exposure occurred through contaminated water sources or direct contact with the urine of infected animals, such as rats, cattle, pigs, and dogs. Urbanization further exacerbated the spread, as densely populated areas with inadequate waste management provided ideal conditions for the bacteria to thrive. Outbreaks frequently occurred in warm, humid climates, where stagnant water facilitated bacterial survival. Flooding, natural disasters, and war-related disruptions contributed significantly to the spread of leptospirosis, exposing large populations to contaminated water. In industrialized societies, infections sometimes arose from occupational hazards faced by farmers, sewage workers, and miners. Recreational activities such as swimming in contaminated rivers and lakes also contributed to infections over time. Public health measures were often inadequate in the past, which allowed leptospirosis to persist and infect many people. The disease's resilience and ability to adapt to a variety of hosts made it difficult to control. Even in modern times, leptospirosis remains a threat in regions with heavy rainfall, poor sanitation, and limited access to clean water. Advances in medical knowledge, hygiene practices, and the development of antibiotics have reduced mortality rates, but the disease continues to affect vulnerable populations worldwide. Understanding the historical context of leptospirosis underscores the importance of sanitation, education, and prompt medical treatment in controlling and preventing its spread. Leptospirosis has caused significant damage and widespread infection throughout history, particularly in regions with poor sanitation and frequent flooding. In historical times, the disease was often misdiagnosed as other febrile illnesses, which contributed to its unchecked spread. Agricultural societies, especially those involved in rice farming, suffered greatly due to constant exposure to contaminated water. During wars, soldiers stationed in muddy trenches or tropical regions faced high rates of infection, with symptoms such as high fever, jaundice, and internal bleeding incapacitating many. The lack of medical knowledge and effective treatments led to high mortality rates and debilitating illness. In the industrialized 19th and early 20th centuries, workers in mines, sewers, and agricultural fields were frequently exposed to environments contaminated by animal urine. Without proper protective gear or sanitation measures, these workers were particularly vulnerable. The disease also struck densely populated urban areas, where poor waste management created ideal conditions for rat infestations, amplifying the spread. In modern times, leptospirosis remains a global health concern, particularly in developing countries. The World Health Organization, WHO, estimates there are around 1 million cases annually, resulting in approximately 60,000 deaths. Major outbreaks continue to occur following natural disasters such as hurricanes, floods, and tsunamis. For instance, the aftermath of Hurricane Katrina in 2005 saw a spike in infections due to widespread floodwaters. In the Philippines, Typhoon Ketsana in 2009 led to over 3,000 cases. In countries like India and Brazil, seasonal monsoons and inadequate drainage systems contribute to recurring outbreaks that affect thousands of people each year. The disease disproportionately impacts vulnerable populations living in poverty, where exposure to floodwaters and rodent-infested environments is common. Urban slums with poor waste management and agricultural workers in waterlogged fields are especially at risk. The economic toll of leptospirosis is also considerable, as it affects productivity due to illness and requires significant healthcare resources for treatment and recovery. Much of the historical and modern damage caused by leptospirosis could have been mitigated through effective public health measures. Improved sanitation is one of the most critical strategies, as proper sewage systems and access to clean water reduce the risk of contamination from infected animal urine. Historically, the lack of these systems allowed the disease to spread rapidly in urban and rural areas alike. Rodent control plays a vital role in prevention, as rats are primary carriers of the Leptospira bacteria. Reducing rat populations through waste management and hygiene practices can significantly lower infection rates. In occupational settings, especially for farmers, sewage workers, and miners, wearing protective clothing such as rubber boots and gloves can prevent direct contact with contaminated water. Public awareness and education are crucial in controlling the spread of leptospirosis. Informing communities about the risks of wading in floodwaters, the importance of hand washing, and seeking early medical intervention can help curb outbreaks. Vaccination for high-risk groups, where available, also offers an additional layer of protection. Implementing these measures consistently could have prevented much of the suffering caused by leptospirosis throughout history, and can still help control its impact in the present day. Leptospirosis continues to be a widespread public health concern, particularly in regions with warm, humid climates and poor sanitation. Historically, the disease was a constant threat to agricultural workers, miners, and soldiers who were frequently exposed to contaminated water. Limited medical knowledge and misdiagnosis contributed to high mortality rates and severe infections in affected populations. Outbreaks were often linked to wars, floods, and industrialization, where humans and animals shared close quarters under unsanitary conditions. Today, leptospirosis affects an estimated 1 million people annually, causing around 60,000 deaths worldwide, according to the World Health Organization, WHO. It remains most prevalent in tropical and subtropical regions, particularly in countries such as India, Brazil, Indonesia, Thailand, and the Philippines. These regions face recurrent outbreaks due to seasonal monsoons, poor drainage systems, and a lack of access to clean water. In developing nations, urban slums with inadequate waste management and high rodent populations are hotspots for infection. Climate change has exacerbated the problem, with increased flooding, hurricanes, and rising temperatures creating environments that favor the survival and spread of the Leptospira bacteria. Natural disasters such as hurricanes and typhoons frequently lead to spikes in leptospirosis cases due to contaminated floodwaters. In 2005, for instance, Hurricane Katrina in the United States resulted in a notable surge in infections. Even in developed countries, recreational activities such as swimming, kayaking, and hiking in contaminated areas occasionally lead to infections. Preventing leptospirosis involves a combination of public health measures, personal protection, and education. Improved sanitation plays a critical role in reducing exposure to the bacteria. Ensuring access to clean drinking water, proper sewage disposal, and efficient drainage systems minimizes the risk of contamination. Managing waste effectively helps control rodent populations, which are key carriers of the Leptospira bacteria. Rodent control is another essential strategy. Reducing rat infestations through traps, poison, and maintaining clean environments helps decrease the likelihood of infection. This is particularly important in urban areas where dense populations and poor waste management provide ideal conditions for rodents to thrive. For those working in high-risk occupations, such as farming, sewage maintenance, or construction, wearing protective clothing like rubber boots, gloves, and waterproof gear can prevent direct contact with contaminated water or soil. Similarly, recreational enthusiasts should avoid swimming or wading in floodwaters or rivers where contamination is likely. Public awareness and education are crucial components of prevention. Informing communities about the dangers of leptospirosis, especially during the rainy season or after floods, helps individuals take precautions. Teaching proper hygiene practices, such as washing hands and feet after contact with water, can significantly reduce infections. Early recognition of symptoms, such as fever, headache, and muscle aches, encourages timely medical intervention. In some regions, vaccines are available for high-risk groups like farmers, veterinarians, and military personnel. Additionally, vaccinating pets and livestock helps reduce transmission to humans. Managing environmental factors, such as draining stagnant water and improving drainage systems, can further limit the spread of the disease. By addressing these preventive measures, much of the historical and modern burden of leptospirosis can be alleviated, protecting vulnerable populations from this persistent and preventable disease.